name is Dr Nyawira Wangechi Minor. I'm a general practitioner. I work at the Diabetic and Endocrinology Center. In medical school, we were not taught research. So what research I happened to have studied was in public health, but even that was not in depth. Like I work in a clinic, we have data, client data, but I've not been able, or I don't or didn't know how to do proper research. By taking the course, then it equipped me to be able to use the data to get something meaningful to help the patients that we see. So there was a lot of learning in this course. The types of data that you collect, the types of studies were not something that I personally came across in my medical studies. So this opened my eyes, my mind, and my ability to read what is research in the present day medical field. I do want to use some of the data we have on the patients that we are seeing, especially because we have a lot of diabetics in this country. One is I can then be able to get the data from our clinic, because those are the patients we see more, and be able to formulate what types, their ages, what treatment works for the majority we see. We also see a lot of other endocrinological problems. The one that comes into mind is the one to do with pituitary tumors, and be able to get Kenyan data on the types of pituitary tumors, the presentations, and how we have treated. This will help impact in that. Unlike diabetes, some of the other endocrinological problems, there's no data, Kenyan data. And that would then help put us in the East African map on what we are seeing. In this country, although we have universities that teach research, for clinicians, most of us are clinicians, period. We really do not go into research. Once we've done it in medical school for what it's taught, we forget it. Now, learning the proper way to do research will help. It will help in getting data in this country, because we have to all admit that even when we look at publications, Kenya is lagging behind, especially in East Africa. We need to come out with the Kenyan data, and this study and this course will help you and help all of us be able to put our Kenya on the map.